December 10th, 2024, regular meeting of the Burlington Board of Health to order. Please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, I'm Dr. Ed Weiner, and with me this evening are board members. Vice Chair is Gail D'Amore, is Andrea Sheehan, Dr. Mara El Sabahi, and Ms. Mary Beth Welch could not be with us this evening. Also, our professional staff, Susan Luminello, our Director of Public Health, Michael Green, our Associate Director of Public Health, our Environmental Engineer, Christine Mathis, and Sandra Triani, our supervisory nurse. First time at a Board of Health meeting. Welcome. We'll talk to you later. We have some questions for you. All right. Next is citizens' time. Is there anybody here? Well, we know that there's no one here. For citizens' time, is there anybody online who has a question for the Board of Health?
No.
Okay. Very good. Okay, which brings me to Chairman's report. Actually, there are no subcommittee reports this evening, and there are no minutes this evening. Correct?
Right.
Okay, we have no minutes to approve this evening. Well, December 2024, where did the time go? This evening is the last Board of Health regular meeting for this year. And it's been quite a year. Our elected board, the Burlington full-time and Triton Grant part-time health professionals, our elected board, as well as more than 200 Medical Reserve Corps volunteers have been very busy this year with so many regular, special, community preparation and emergency roles that were carried out in 2024. From the inspection of restaurants and food establishments to the coordination of land use and developments, and from ensuring the cleanup of our lingering contaminated sites and working to prevent new ones, focusing on Burlington health promotion and safety and offering all kinds of educational programming, it's been an outstanding year. On behalf of the elected Board of Health and every one of our professionals, we hope 2024 was good, well, and safe. We wish you a wonderful holiday season and a happy new year. And be assured, we will be back twice a month next year. And as always, we are only a phone call away. Okay. Which then brings us to our variances. We have nobody here for a variance. We have and permits for the minimal standards for the keeping of animals. I'm going to continue that in case the proponents do show up, unless the board would like to address those now. I'll ask, should we address them or should we wait for the proponents to be in here? It is a variance and an approval of a permit.
I feel we should wait. I think we should wait.
I think we're all in agreement that we should wait. And if they do not arrive this evening, I'll ask our professional staff to please give them a call and find out what's going on, because they have to come in for a variance and they have to come in for this approval of the keeping of animals.
I just have a question. So, in the interim, is there any?
Here comes someone now.
You here for the Board of Health?
Ah, good.
Are you here for 11 Algonquin?
Yes, I am.
Okay, great.
Okay, good. We were just talking about
You can actually
you.
go sit over there, so you have a speaker.
Sorry, I was late. I went the other way, Center Street.
It happens.
Okay. I'll try to pronounce your name,
I go by Osho, O-S-H-I-O.
O-S-H-O. Could you please, though, sign in, print your name, just for our recording secretary?
Okay.
Oshiashu, is that,
Oh,
what did you say?
Osho Kweme, but I go by Osho.
Osho.
Yes.
We apologize for not being able to.
No trouble at all. No trouble at all. Absolutely no trouble at all.
So you're here for two reasons this evening.
Yes, sir.
First, for a variance,
Okay.
and then for a chicken permit,
Okay.
okay? The variance is something that you are not in conforming with
Okay.
according to the town regulation.
Okay.
And I will ask our Director of Public Health to explain what's going on here and how the zoning agent, who is the building inspector, has weighed in. Please.
Yes, so this first came to the Board of Health's attention because we had gotten a complaint about a rooster. And in investigating that complaint, it was determined that the occupants at 11 Algonquin Drive didn't have a chicken permit. They did get rid of the rooster. They've had chickens all along, and they had less than 3 chickens, so they didn't realize that our regulations had changed from 3 or more to any amount of chickens, so they've had the chickens for, what, 10 years?
Yeah, 10 years, yeah.
So it's had the chickens for many years. And the coop is located less than 15 feet from the property line, and I guess it's always been there, right, for the 10 years, which does not conform to our regulations, or the building department regulations. We did notify Mark Dupel, the building inspector, and they are choosing to take no action on that at this time. We don't have any control over what the building inspector does anyway, so the variance would be for our regulations and vary the setback of that 15 feet. So that's what the variance is, and then after that would be the request for the permit for the keeping of 3 chickens.
Okay. Would anyone like to weigh in on the variance? Because we need to talk about the variance first.
Can I ask?
Sure, please.
Just for my own understanding, so is it a new regulation that you have to be 15 feet from the fence, or is that
That's always been a thing.
okay,
So that's just 15 feet. Any structures has to be 15 feet from every property line.
and then is that part of what we regulate, or the zoning? Like,
That's
part of,
Yeah, that's regulated by the building department.
I see.
However, our regulations do say that you have to conform to that 15
I see,
feet.
okay, thank you.
And the building inspector is not going to take any action at all. He's been
Yeah.
there 10 years.
We included the email from the building inspector
Yes.
in your, Marlene did email him to
So
let him
he's
know.
grandfathered in.
He
I don't
answered.
know if it's grandfathered is the right way to term it. He might be
Okay.
looking the other way, but that's what shall we.
Okay, so that's the wrong term to use.
Yeah, it sounded like, he's leaving it open. He's not going to do anything at this point in time, but if something came up where he had to, then that's what it sounded like.
We have had no real complaints except for a rooster. None of the abutters have weighed in. I see nobody online. I see nobody here. They receive certified letters. My feeling is that we should, well, by approving the variance, we approve the variance until there's some other issue, and if there's some other issue, we can act through the regulation of the keeping of chickens, correct?
Well, you're approving the location of the coop to be where
Okay.
it is. So you're saying the coop can be in this location?
Correct. However, if we have no problems, he's had no problems in the past, If there is a problem, the coop could stay, but we just wouldn't allow him to have chickens, correct?
Or we'd have
Yeah.
to move.
Or you'd require the movement of the coop,
Coop.
which seems unreasonable at this time.
At this time.
Right.
So,
I believe that the coop is sized for 3 chickens. So if he wanted any more than 3 chickens, he'd have to add on
He'd
to
have
it,
to
and he'd
do
have to come
something.
back to us, and then we'd probably bring it back to the board, if he had to add on to the current coop.
So the only concern I have is that, the rules were written for a reason. We're obviously not rewriting the rules, but by approving a variance at any time, it doesn't look like we enforce the rules. So it sets a precedent that I'm not really comfortable with. And that's a longer vision of concern, not so much specific to this issue, but it does set or start with a variant here, letting that go. So I want to be cognizant, and I want it noted that that's a concern, because I think it sets a precedent that I don't necessarily think we want to do.
okay. Anybody else like to speak on this? Okay. I feel that it's been 10 years. I feel that it's for 3 chickens. I feel that the person who is responsible for zoning in the community feels it's not an issue. And I feel that if it's 3 free chickens and the chicken coop is too close, and we can address it later through the regulation if necessary. So,
You can always revoke the variance, that's what you would.
correct. So to that end, do I have a motion to approve the variance? I have a motion from Dr. Sabahi, second by,
I'll second.
second. Any more discussion? If not, all
I
in
just
favor?
have a question.
Please.
With approving it, do we have to put any of that stipulations? Are there any stipulations that we're putting in? Or is it just if something goes wrong?
Well, we have no
Okay.
stipulations. It's just the fact that for this particular situation, we're going to
We're going to approve the variance?
approve the variance.
But
We're
if
going to vote
anything-
to
We're
approve
going to
it.
vote to approve the variance. It can, in the future, be revoked, or it can be,
Okay.
we could have an issue with the 3 chicken issue, which we'll talk about the regulation in a minute, which is, okay? So all in favor, say aye. Aye. Oppose?
Nay.
Opposed? So 3-1-0. Okay? Now we have to, and that is passed. Now we have to talk about the keeping of chickens, which is only 3 chickens. You've had them for 10 years, sir.
I beg your pardon?
You've had the chickens for 10 years.
Yeah. But my kids wanted a dog. I'm not ready for dogs, so I went with the chickens instead. It's lower maintenance.
Are you getting eggs?
Yeah.
And you've had no problems? We've heard nothing from any of the butters?
No, I've actually had no problems. I share the eggs with my neighbors. What happened, we get the chickens as a day old.
Yep.
They know me down at the post office. I get them from a hatchery in Ohio, so they come and it's a day old. I couldn't tell it was a rooster. The kids named them.
Oh.
It started crowing. I'm like, this is going to be a problem. I know what the rules say. It's going to be a problem. Said to one of the kids, hey, this has to go. And she's like, why does my chicken have to go? I'm like, it's going to be a problem. I was at work one day. I got a text from my neighbor. Hey, look, chicken's a problem. I came home that day. Off went the head of the chicken. A few days later, I get a letter that I have to be here, which is totally understandable. We've had them for many years. Not a problem. And didn't mean an inkling. I knew it was going to be a problem because obviously, I'm like, even before I moved to Burlington, I actually called and asked if I could keep chickens. This was many years ago, and I was told, yeah, you can keep 3 chickens without a permit. Anything longer than that, you require a permit. So I looked into it, way ahead of that, and I wasn't trying to be a scofflaw in any way. I just got a chicken that didn't know it was a rooster.
Any other questions? I have one question.
Go on.
You just said something. Mr. Osho,
Yes, sir.
you got the chickens in the mail?
Yeah.
I didn't know you
I didn't think you could do that either.
They get them. You can get them online. It's and then they bring them. They bring them, the one I use, it's in Ohio. It takes about 3 days. They take them to Woburn, then it comes to Burlington. I go to Burlington to pick them up. And they're actually very nice. They feed them, they take them out, they give them water, so, because it's a 3-day journey, so. and-
Wow.
Yeah, they take good care of them at the post office. It's not
I'm a
problem.
city, or I should, a town boy.
Pardon?
I never do this. I guess I'm a city boy. I see the chickens at Tractor Supply,
Yeah,
but I didn't realize you could,
yeah, yeah. Yeah, it's fun. It's great fun. You can pick whatever breed you like, whatever ones are hardy and which ones are, now we're talking about chickens now. Now you get to pick which ones are winter hardy, which ones, which ones, whichever breed you want, what kind of, depending on the eggs, depending on if you want Easter eggs, what color eggs you want. You get to pick whatever you want. It's good fun. Kids enjoy it.
but so do I have a motion to approve? So I'm going to go foul here. I have a motion by Mara, second by,
Approve.
Mr.
Vice-
Chairman.
Second.
And there is 7 conditions.
there are 7. Did you see the conditions?
Yes, I have. I received the letter that you had referenced earlier, and I had the opportunity to look.
You have no
over.
problems with those conditions?
No, absolutely none whatsoever.
Thank you very much. So with the 7 conditions, 3 chickens, okay?
Yes, no, so one of the conditions
Is
is
it
that.
max?
Yes.
Yeah, maximum of 3.
3.
Yeah. I have 3 kids, so each kid gets a chicken. So that's what it works out perfectly. So
I know roosters, sir. No more roosters.
Absolutely. No, I knew that going into it. Like I say, I started this time like, oh, this is going to be a problem. But it was just trying to get one of the kids to. My son was okay with. I have 3 kids. My little kid, the middle one, happened to be the one that had the rooster. My son's like, Daddy, let's eat it. And she's like, no. I was like, so they knew it was going to be a problem. But anyway, we've sorted it out. And it's going forward, it won't be. It wasn't an issue before. It won't be an issue going forward.
I have a second, and I have a motion, I have a second. Any other discussion? If not, all in favor?
Aye.
4-0-0. Thank you for coming, Mr. Oshie.
No, thank you, and I apologize for being late. I got lost. I went that way, and I'm like, there's nobody here. And they're like, this isn't. I didn't actually read the thing. It was like the town meeting. I'm like, and I spoke to a gentleman and he said, you have to go this way. And I'm like, fair enough. So I apologize.
No problem.
I apologize.
Thank you for coming.
Am I dismissed?
Happy holidays.
Oh, thank you. Thank you guys very much. Again, I apologize for the inconvenience. Thank you all. Thank you
Very
all very much.
healthy and safe and wonderful
I
holidays.
know, maybe one of these days, I think they usually have, I don't know if they still do it, like the farmer's market in town, they used to do it down that way, eh? All right, maybe one of these days I'll bring some eggs. We'll see. No, seriously, anyways, no trouble.
Refrigerator.
Thank you all very much. Yeah.
Thank you.
Thank
We will.
you.
Thank you.
All right. That was good. And, all right. Where are we here? All of a sudden, I lost my agenda. There it is.
Variance
There it is.
permits
So, the next is fiscal year 2026 Board of Health budget. Do you want to?
Yes, so everything is, so I included 3 things here. One is the budget itself, the other is the Ways and Means cover sheet that goes along with the budget, that gives an explanation. And then the third thing is the mosquito control estimate for services, which does include the maintenance of ditch networks to reduce the habitat at 12 hours of ditch maintenance. Everything on the budget is same as last year, other than the mosquito. So the mosquito has increased 1,755 for the ditch maintenance, and then also there's, on top of that, is a cost of living increase on that, which they haven't had in quite a while, I believe like 2 or 3 years anyways. So that has increased our budget. Overall, we have a 3.23% operating budget, and I don't know if anyone has any questions.
Well, I have had to defend the budget for many years now with the director, and I don't see this any issue whatsoever. And the only problem, or the only increase we had, is that ditch maintenance will be a positive step in mosquito control, and it's in collaboration, and it's working along with the Conservation Commission, who did not have the funding to do that, and I have no problem with this. Anybody else want to? It's low-level funded.
Yeah. The reason why I included that ditch maintenance in the budget is because a few weeks ago, 3, 4, 5 weeks ago, we were contacted by the Conservation Administrator and the Assistant Town Administrator about doing ditch maintenance in a certain area of town that there was issues around it. So we reached out to Mosquito Control to get an estimate on it. And the estimate, I believe, was what, 4,000 or 5,000 for this
5,500.
ditch maintenance. So overall, it's cheaper to include it in our budget, because now we get the 12 hours for basically 1,700. If we had to do it after the fact, it's gonna cost the town a lot more. So that is the reason why, you know, and also in talking to the Conservation Administrator, we thought it was a good idea to include it in the Board of Health budget, because in the long run, it will be cheaper for the town. And it's a good practice, as you heard when East Middlesex Mosquito Control was here, talking about ditch maintenance and how it can be helpful. So it's one of the things that we haven't done, which we did also discussed at that meeting. And like the chairman said, everything else is level funded. Overall, the grant per total percentage increase is 1.5%. The special account line item did increase 5%, so that's kind of what kind of bumped us up.
Any other questions? So if we are to pass this evening, I need to sign this, is that correct?
It all goes electronically now, so it's all in the budget drive, so we don't need to submit any hard copies.
Okay, good. Do I have a motion to approve?
Motion to approve.
I have motion approved by Gail. Is there a second? Second by Ms. El-Sabati, Dr. El-Sabati. No, any other questions? If not, all in favor? Aye. 400. Thank you. It won't be reviewed by the subcommittee for probably a couple of months, or?
Yeah, so we're going
We're
to
way
Ways
ahead.
and Means, I believe it's the third week in March.
319.
The 19th, yeah. So usually the subcommittee reaches out 2 days before that meeting to schedule a subcommittee meeting, and then we'll need to go to that meeting on the 19th.
Good, thank you so much. We're way above the timeline. Okay, the next is a 2025 Board of Health meeting schedule. I hope you reviewed that. I think that works out well. We do have a couple of religious holidays listed, and I have spoken to Dr. El-Sabati, and you're okay with those. We have some holidays listed, and as always, if we do not have any business on any of these meetings, we do cancel the meeting, because we don't want to bring all of our professionals in to do nothing except do brief reports. It's not cost effective. So if everything else is okay, I should first, are there any other questions for?
In terms of the schedule?
Yeah, any questions of the schedule? If not, I'll ask for a motion to approve the schedule, the 2025 Board of Health proposed meeting schedule. Do I have a motion to approve? Dr. El-Sabati, motion to approve. Is there a second?
Second.
I have a second by Gail. If there's no other question, any more discussion? If not, all in favor? Aye. 400. So we can move on to that, which brings us to staff reports. And this is a real privilege this evening, because this is the first time we're going to have our new supervisory nurse, who is going to introduce herself, is Sandra Troiani. Introduce herself. She's been here about 2 months now, or 3 months?
6 months.
Oh, 6 months. Time flies. 6
I
months.
started in May, so more than 6 months.
Well, All I can say is it's been wonderful so far, and we very much appreciate you being here. Are there any, she has submitted a report. Do you have anything to summarize on that report? Is there anything, there really wasn't very much for her to summarize, but she promised she would answer some questions to the board. So, can I start?
Yes.
Tell us about yourself professionally.
Sure, I could start by telling you that I always had a strong desire to help people, and I love what I do. I've come from a very diverse background, and I am bilingual. I worked as a nurse successfully with children, adults, and elderly in different settings out in the community. I have worked in hospitals, assisted living, and schools as well. I am very honored to work for this town now.
Thank you. And I have one more question, and then I'll throw it open. What would you like to bring to Burlington?
So my plans for the community, for this community, is to provide public health for all, promote health awareness, and provide health education. My ultimate goal for this town is to see every resident thrive emotionally, physically, and mentally.
Thank you very much. Anybody else have questions? You do have an impressive background. So far, it's just been a pleasure for you to be here and to see how quickly you have come into town and working with the community, and specifically the vaccine program, the school vaccine program has been tremendous working with our director. Thank you very much.
My pleasure.
Is there anybody else have any questions? Well, thank you so much for coming. I have been telling you had to come sometime. So could I please have a motion to approve the supervisory nurses report?
Second.
I have a motion and I have a second. All in favor? Aye. Thank you so much. The next is the environmental engineer. Is there something that you'd like to?
Yep, I just have a couple of things. So from my report, you can see that I did some hazardous material storage permit inspections, and there are about 90 companies that we permit under that program in town, and I do the inspections between May and November, so those are done for the calendar year. And let's see, we had one environmental spill over at 30 Corporate Drive. It was about 15 gallons of hydraulic fluid from a truck, and it was contained on pavement. It didn't reach any catch basins or anything like that, so pretty simple cleanup. And lastly, the chairman had asked me for the total number of, historically, the total number of contaminated sites that are in Burlington under the Massachusetts Contingency Plan Program. And so I went and I looked at the total number since the MCP came into existence, and there have been a total of 287 contaminated sites in town, which could be anything from long legacy historic contamination from, industrial operations in the 50s, 60s, and 70s, or similar to the spill I just mentioned at Corporate Drive, where 15 gallons of hydraulic fluid that gets cleaned up quickly. Of those 287 over the course of history under the MCP, there are 110 that are still open, so they're still undergoing some sort of either monitoring or remediation. The remainder of those have been closed either as permanent solutions with no conditions, which means basically they've reached background for contaminants, or proven that they have low enough levels and reaching background is not feasible. But the levels are low enough that they don't pose an environmental concern. or they've been closed with an activity use limitation, which is, you you can't put a garden here, or it has to be under pavement, or there's a whole different variety of AULs that can be imposed. Or finally, they may have been designated as having down gradient property status, which means it was not the fault of the property owner where the contamination lies. It is the fault of an off-site source, and that discovery of the source has been tied back to that other location, so they've been joined. So that's the summary of contaminated sites in Burlington in a nutshell.
Thank you.
Yeah.
That's great, thank you.
Great.
Before we ask the questions, I just want to reiterate, you've always been very, very busy, and Ms. Mathis, the last month, and all of our reports go from November 1st to November 28th, you've involved in hazardous material permit inspections, hazardous material disposal permits, demolitions, certificate of occupancy, septic system removal. I didn't know we had that many, but we had one.
Yeah.
And
We don't have a lot, but we still have a few.
and the oil spill. So I just want to point out for those people who may be watching how busy you are.
Thank you.
Any other questions? Any questions? I just have one. There are two, Fabry and Dynacure are coming for special permits. When do you expect them?
Fabry has been withdrawn just recently.
They're not coming?
They're not coming. They had a problem with finding a location that was amenable to them, and they're still looking, but they formally withdrew their special permit application. And Dynamicure, you may recall that Dynamicure has been before you for a special permit. They are ultimately coming to us for both a hazardous materials storage permit and a biological safety permit. They're not at that point yet, but they had filed for a special permit to install a diesel generator, and it was ruled after the fact by the zoning compliance officer that because they're in the Aquifer Resources District, they cannot have a diesel generator at their location, so they'll have to stick with their original plan, which was natural gas. So both of these have been withdrawn since I wrote this up.
Thank you very much.
Yep.
If no other questions, could I have a motion, please, to approve the environmental engineer report?
Motion to approve?
I have a motion to approve by Ms. Sheehan, second, Mr. Mori. All in favor? Aye. That's 400. Next is the Associate Director of Public Health, Mr. Green.
Thank you, Chair. Thank you, Board. I'd like to highlight the wonderful time I had at UMass Lowell. I went to their public health senior seminar and gave a little presentation on how I got into public health, information about the Burlington Board of Health and the BVRC, and that was wonderful. I was able to meet our selected intern for this next semester. Also went there, so it was very enjoyable. It was fun to see all the new fresh faces coming into public health.
Any questions? The BVRC has been very busy, and tomorrow night we have?
Tomorrow night we have our appreciation dinner for the volunteers for this year, and we have a comedian, and we also have the Burlington High School Chorus coming to perform for our volunteers.
And we're all invited. So I will be there, and thank you so much. Any other questions? If not, I'll ask for a motion to approve the Associate Director of Public Health. Mr. Mori, second by Dr. Sabai El-Shabat. All in favor? Aye. 400, which brings us to the Director of Public Health. Now, you will be representing both the Associate Health Inspector first, and then the health agent, and then your own report. All reports are for the month of November. So to that end. Is there anything that you'd like to highlight for the Associate Health Inspector?
No.
Okay, I have no questions. Does anybody have any questions? Okay, the second is the health agent. Is there anything you'd like to highlight, health agent?
Yes, so Marlene just completed a mock foodborne illness tabletop exercise.
I'm sorry, what is that, please?
It was a mock foodborne illness tabletop exercise for our staff, and the reason for it was to meet one of the retail standards. So if you don't have a foodborne illness outbreak in the past year, you're supposed to do like a mock exercise. So she wrote the whole thing, and all of the staff came and went through her exercise, and it was really great. I thought it was really helpful. She did a great job, and you know, it was, I think the staff learned a lot, so it was a good thing.
It's great.
Any other questions? Anybody have? There are 6 new restaurants coming to town. 6 new restaurants and food stores, or I don't know all of the names, but coming, and maybe we can talk to her at the next meeting about that. So I just wanted to tell the public that, yeah, 6 new are coming to town. Okay, now it comes to the Director of Public Health's report. And is there anything you'd like to highlight?
Yeah, I just like, while Sandy is here, I'd just like to say that I've heard from more than one school nurse about how great it is, the work that Sandy is doing, and how glad that she's here, because they've seen a real difference in getting the kids vaccinated, and it's just such a smoother process because she's bringing them into the office, she's bringing whole families in, and she's getting it done quickly. So they are all thrilled how it's working.
Does anybody have any questions? Well, I sure do. Statewide accelerated public health for every community public, SAFE 2.0, where they admit they are going to overhaul the state's broken public health system. That's their line, not mine. You know, I know someone who has been talking for 36 years about the state public health, the overhaul the state's broken public health system. I feel vindicated. Do you know who the person who's been saying that for 36 years, that it's been broken? And it's a real step in the right direction. Is there anything there that you particularly like, or the whole thing is good?
Yeah, and it's just, I guess this is the beginning. So it's good. It's a beginning. This act passed, and now they'll make requirements for boards of health. So boards of health will be required to do certain things. We already do them all, I'm sure. So I'm not worried that it's going to change the way that we do things, because I think we're already there. But you know, we'll see. They're going to, you know, create these uniform systems, and so I think that's a good thing, so that each health department does things the same way. Many times we hear from applicants that say, well, I, you know, did it this in this town and I didn't have to do that, you know, and why do I have to do that in Burlington? That type of thing. So it will help with that, where, you know, every health department is acting in the same way. So it is a good thing.
Since the appointment of the Public Health Commissioner, or the Commissioner of Public Health, Robbie Goldstein, there have been a lot of major advances. I have not yet met him. I would like to meet him in 2025. And maybe Susie would like to come to, if I can get an appointment with him at the State House, like to come with me, or any other members of the board. But I really like to meet him this next year, the first quarter next year. So, is there any other questions?
I just wanted to ask, so were there any specific highlights about the changes that are coming? I just, you know, things that are really need to be tackled that we should, I'm just curious.
You mean on the DPH thing?
Yes.
Yeah.
So yeah, it's very vague, honestly.
Interesting, okay.
You know, from what I'm seeing. So they're gonna, as you can see from this that they put out, they don't really give specifics on, what exactly they're going to be doing.
Okay.
Other than the specifics that they've given under, I guess, the grant program. So the grant program was the start of this. So they're trying to streamline things, I think, through that grant program. So through the grant program, we have requirements, we have a work plan, and the last work plan we had was more specific. So it wasn't like just you can choose your own what you're going to work on. It was kind of narrowed down. So I think that they're going to be kind of doing it through that avenue of these grants and through these coalitions.
Okay.
It seems to be, but they don't really come out and say that. They're looking for a uniform data collection system and things like that. So I'm thinking one of the things that they're going to work on is software for inspections, which is a real need, but I don't know when that's going to come out. And we're doing that now.
Oh, I see.
Through our grant. But that is something that, to have kind of like Maven for inspections.
Standardized.
Yeah, standardized way of doing things.
I see.
So standardized inspection forms for each type of inspection, things like that. Standardized maybe, regulations. So regulations are similar from town to town.
Yeah, they listed, I took a bunch of notes on this because I was really interested in this, since I have been a critic of the Massachusetts Department of Public Health for a long time. But there are 4 goals, and you can read about them. The first that I wrote was establish minimum public health standards for every community. We really need to do that, as our director said. Increase capacity and effectiveness of shared services. We're a recipient of that, correct? Create uniform data collection, which he's already mentioned. And the last was increase equity, I don't know what this means, equity access across the Commonwealth. So we'll have to see what that is, and that has to do with funding.
Yeah, and I think that's probably, again, through the grant program. So they're funding each one of these coalitions through that.
So a real step in the right direction, and I'm kind of happy about this. I'm kind of driven. So that brings us to the end. This is the last meeting of 2024. Again, on behalf of the board, and each person can note this if they'd like, we wish Burlington a safe, a happy, and well 2025. Would anyone else like to add that? If not, I ask for motion to adjourn.
Motion to adjourn.
I have a motion to Ms. Sheehan, second by Ms. Demore. All in favor?
Aye.
Good night, everybody. See you in 2025.
See you.